All right, let's go ahead and review this. So first off, this is a story about Jane and her husband Brian, and they're going into the doctor. And what is the issue that they're having? Infertility. So they're doing a fertility assessment. And they looked over the medical finals. They did some blood tests. We've been trying to get pregnant for 2 years now, and nothing's been happening. So quite a long time. And they're both young, with no obvious explanation for why they may be having infertility. Let's see what's going on with Jane. She's a 28-year-old Caucasian or white female, diagnosed at age 14 with irritable bowel syndrome. What do you know about irritable bowel syndrome? Irritable bowel syndrome is just kind of a general categorization that has to do with inflammation in the gut, and it can be diet related, it can be related to the gut microbiome, all that type of stuff. Diagnosed with anemia in her early 20s. What is anemia? It's when you have low oxygen in your blood, and that can be due to low hemoglobin levels, or it can also be due to low red blood cell count. She has an active lifestyle, but she's had some joint pain recently that's hindered her. Okay, hormone levels are normal, but the big thing here is she's tested positive for several classes of autoantibodies. So the doctor asked Jane, have you been able to control your irritable bowel syndrome symptoms? Do you still have bouts of diarrhea or constipation? And she says, I've never really been able to control the symptoms as she's liked. Okay. Okay, so first off, let's pretend you're Dr. Klein, and Jane had positive levels of autoantibodies in her blood. But first off, let's just explain what an antibody is. I'm muted. Where am I muted? So can we explain what an antibody is? Anybody have an explanation of what an antibody is?
If they don't have like any understanding in the medical field, it's probably just best to be general with it so they don't like overcomplicate it in their heads. I simply wrote everything that produces lots of antibodies, and each antibody is made to combat a specific antigen, which I wrote for this, which are bad for you. So it's like, if you were being really broad with it, we could just say the body produces lots of them, and each one is made to combat a specific problem.
Sure, we can say it's a protective protein, perhaps, that's made by what type of cells make antibodies?
Red bone marrow.
B lymphocytes make antibodies. So they're protective proteins against pathogens, infections. Yep, anything like that is good. So based on that definition of an antibody, how would we describe what an autoantibody is? Yeah, it's an antibody I like where you're going with that, Jasmine. It's an antibody that attacks your own cells. What are some examples of autoantibodies and the diseases they're associated with? We talked about a couple in the endocrine system. What were a couple autoantibodies we talked about in the endocrine system? Graves' disease. What were the autoantibodies against for Graves' disease? The thyroid stimulating hormone receptor. What's another one from the endocrine system? Diabetes, type 1 diabetes mellitus, and the antibodies are against beta cells in the pancreas. And then I'll let you guys come up with a third one, but there's a lot of different rheumatoid arthritis, for example, is an autoimmune disease. So I'll let you come up with that third one. Given her digestive problems and the presence of autoantibodies indicating her condition is autoimmune, what are some possible autoimmune diseases that Jane might have, considering that we have digestive problems and autoantibodies? Celiac disease, all right. Are there any other autoimmune diseases that are related to digestive problems? Crohn's disease is autoimmune, I believe. And then I had to add this question in myself. They're coming in here for infertility, and we're just assuming that it's Jane that's infertile, right? Takes two to make a baby, though. Takes sperm and eggs. And so is it possible that it's Brian's infertility that could be happening? Absolutely. So let's get some samples from Brian. What do we want to run for Brian? Sure, let's have him do some stuff in a cup and get a sperm count, sperm motility would be good as well. That'd be good. Let's do a hormone panel. Specifically, we want to look at testosterone. So that's a good place to start. So Jane's a little confused. She says, what does my immune system have to do with infertility? And the doctor says, infertility can unfortunately be a complication of several autoimmune diseases. So based on your history of gastrointestinal issues, along with the presence of several specific autoantibodies, I believe you may have celiac disease. Okay. And I'd like you to go to a gastroenterologist to confirm the explanation. And then there's but I thought Jane has irritable bowel syndrome. And the doctor's like, well, they may have misdiagnosed her with IBS when all along she had celiac disease.
How common is it for something like that to happen, like a misdiagnosis?
Like I said, irritable bowel syndrome is just it's just kind of a broad term for a set of symptoms, and so it's very possible that somebody has a diet intolerance or some kind of gut microbiome issue that could have been, Crohn's disease or celiac disease or ulcerative colitis or anything like that. Exactly. And if they don't do further testing, And they're just like, oh, well, we think it's this, but they haven't, exactly, then that's a possibility. Okay, can we describe what celiac disease is? Well, first of all, I'll get us started. It's an autoimmune response against what? What triggers the autoimmune response? Gluten. What is gluten? Yeah, it's a protein. It's a wheat protein, essentially. So it's an autoimmune response. I guess I should say triggered by gluten. And what do the autoantibodies? It's triggered by gluten, but what are the autoantibodies attacking? That attacks the lining of is it the small intestine or large intestine? Okay, I'll abbreviate that, small intestine. Good. How is celiac disease different from a gluten intolerance or a gluten sensitivity? Yeah, celiac disease is autoimmune. That's the big one. Whereas a gluten intolerance just means that your body can't digest it. Okay. What specific autoantibodies are tested for with celiac disease? Did anybody come up with anything? I had to look this up. Basically, they're anti-gluten antibodies or anti-gliadin antibodies. Yeah. And what other diagnostic tests need to be confirmed to or performed to confirm this celiac disease? What's that? Right. Yeah. Okay. So that's something that would help determine if that's the problem. Take her off gluten and see if the symptoms persist. What about in the meantime? Is there any diagnostic tests we can do? What they want to do is run an intestinal biopsy, a little tissue sample from the intestine, and what they're looking for is degraded cells along the small intestine. So now Jane's kind of given herself, being hard on herself. She's wondering if she could have prevented this. Is there anything Jane could have done to prevent the development of her disease?
Further testing about the IBS. That's
Yeah, that's not, the disease would still be there. So really, there's nothing she could have done. If they would have done further testing, she still would have had the disease. Okay. But are there any risk factors that Jane falls into with autoimmune diseases? I had to find this out, but autoimmune diseases are more likely in white or Caucasian women in particular. And then I'll let you look this one up here. This is an emerging topic, but basically what hypotheses are used to explain the onset of autoimmune diseases? So that's something that I'll let you guys look up and try to come up with. So they get the test results back, and it does appear that Jane has been suffering from celiac disease. And this is her gastroenterologist saying this. Okay. And really, what's the only treatment for Jane for celiac disease? Eliminate gluten in the diet completely. And Jane's kind of lamenting because she really likes bread and pasta. You know, she's wondering if she can have that at all. And unfortunately, that's not an option.
How much times the gluten-free option?
Sure. What she can do is find the gluten-free products. Okay. And question 1 here is, what's a possible diet for someone with celiac disease? I'm going to let you do this on your own: breakfast, lunch, and dinner, gluten-free diet. What problems could a child with undiagnosed celiac disease encounter? What's the problem with celiac disease and the degradation of the lining of your intestines?
If you keep on eating gluten, it's just going to further degrade your whole immune system.
It'll further degrade your intestines, but why is that bad?
Because then it's going to make it worse eating other foods.
But why is the fact that your intestinal lining is being degraded, why is that bad? Malabsorption. Is potential malabsorption of nutrients, is that related to her anemia at all? I'd say so. Let's say she has low hemoglobin levels. What is it about malabsorption that could result in low hemoglobin levels? What do we need for hemoglobin to make hemoglobin? Well, first of all, we need proteins to make the globin chains. And what mineral do we need to make hemoglobin? We need iron. Okay. So if you're not getting enough proteins or enough iron, and actually vitamin B12 is required to make red blood cells. If you're not getting enough vitamin B12 because you're not getting good enough absorption of nutrients, then that could certainly result in anemia. Why might Jane still have intestinal flares despite removing major sources of gluten from her diet? So let's say she removes gluten from her diet, she eats all gluten-free products. Is it possible that she could still have intestinal flares? And why is that the case?
Because she's been eating gluten for so many years, right? And degraded
Well, let's say that, it doesn't last forever in your body. So let's say she gave it enough time where it should be eliminated from her body. Yes. Exactly. I'm going to call that inadvertent exposure. Okay, it only takes a trace amount of gluten to trigger the problem.
I have read that you can sometimes see the gluten in medications and other non-products that sometimes mix up with the gluten.
Just a little, yeah. Some of it, a lot of times gluten is processed on the same belt, the same track as non-gluten stuff, so. What other diseases are people with celiac disease susceptible to and why? Well, we said, yeah, that's a good one. Anemia. Also, other autoimmune diseases. People with celiac disease are more susceptible to other autoimmune diseases. I think it's just if you're producing autoantibodies against something, then you're more likely to produce autoantibodies against something else, type of thing. Yeah. And then I'll let you do this last one. Do a literature search and describe why autoantibodies may be linked to infertility. Okay, because that's the whole issue, right? She came in with infertility issues, and autoantibodies may be the cause of that infertility. So I'll let you guys look some stuff up on that. I did do some research about how this is specifically happening. And so this is the lumen of the intestine. This is the intestinal lining. And what we have here are gluten peptides, which are making their way across the intestinal lining into the connective tissue underneath. And basically what's happening here is you have this is a dendritic cell, but it's basically an antigen presenting cell. It's a macrophage. It engulfs the gluten. It thinks the gluten is foreign, so it engulfs it. And what does it do? It presents it to other white blood cells. Okay, and it kind of triggers a response. And ultimately what happens is these antigen presenting cells are triggering the activation of these T lymphocytes. Okay. Then you actually have these other lymphocytes that are found in the intestinal wall, and it's kind of this cascade. So let's go through this again. The gluten is engulfed by these antigen presenting cells. Then basically these antigen presenting cells activate a whole host of other white blood cells in the body. And those white blood cells are basically attacking and degrading the intestinal lining. Okay. So it really is an autoimmune disease because you have the body's own cells, the body's own lymphocytes that are attacking the intestinal lining, the intestinal cells. And this is all triggered by gluten. Okay, what do you guys all think of that? Okay.